To unpack this discussion a bit more further, we're now joined by South African Medical Association Chairperson Dr. Mvuyisi Mzukwa, and he joins us now via our video link. Dr. Mvuyisi, thank you so much for your time this evening. I mean, there's an urgent need for doctors in our healthcare facilities, be it clinics as well as hospitals in the country. At the same time, we have doctors who are sitting at home who are unemployed. Surely this should be a major concern and should be prioritized by government.
Good evening to you, Mbali, and to your viewers, and thanks for inviting me. Mbali, we really have a serious concern, and I think we're facing a paradox in South African healthcare system. We have a critical shortage of healthcare personnel in our hospitals. Yet, as you pointed out, thousands of qualified healthcare workers, 1,800 to be specific, of doctors who are qualified have gone through training, 8 years of training, and they've done an extra 1 year of community service. Those are fully qualified, polished diamonds who are sitting at home unemployed, by government. Now, the greatest problem about this is that it creates a very, very dangerous environment or conditions in the public hospitals, because what you could expect is that the existing healthcare workers, those that are at the hospitals as we speak, they are shouldering unsustainable workloads. And that is leading to unprecedented levels of burnout and depression on those doctors that are in the healthcare system.
And that burnout then means that, South Africans are not getting the proper services that they need from our hospitals.
You will recall, Mbali, that there was a case of Tom London that came out here, where Tom London was complaining about the attitude of doctors and stuff like that. So you can now see the context. How do you have a smile when you have burnout at the same time? So what has happened now in Gauteng? They have come up with a very simplified way of dealing with this, and they said, no, let's come up with something called Serve with a Smile campaign. But you have not addressed the material conditions. A smile comes out of a conducive environment. You don't expect a doctor to be overworked, to have burnout, and then you expect the same doctor to smile. It's a fallacy. It will never happen. So it is, how the doctors are feeling, and that's how they're expressing themselves. And you will recall that there was a time when Tim DeMeyer was expressing the frustrations, regarding the conditions in the hospitals. And he wrote about one of the hospitals in Gauteng, that he was working in. You will recall what this government did to Tim DeMeyer. They vilified him, they humiliated him, subjected him to disciplinary hearings. How do you do that, Mbali, when somebody is expressing how they feel? Those hospitals, these working environments are not psychologically safe for the employees. They can't express themselves. Even if they feel the pinch, they must still smile. They are told to smile.
And I mean, Dr. Mvuyisi, you, I'm sure, have raised some of these issues, with government. What are they saying to you as, the Medical Association?
We are told that there are no funds. That's what the minister is telling us at national government. But we do not believe that. We believe that there is money. The problem with money, it is being mismanaged. Between 2009 and 2013, when this minister was at the helm, 24 billion was lost to corruption. And during the period of, you remember the COVID-19 period, between April 2020 to around June 2021, we are investigating 14.8 billion, in healthcare spending under corruption. So you can imagine, Tembisa alone, just one hospital, the corruption is estimated at 3.4 billion. So you can imagine that these 1,800 doctors, you just only need about 2 billion rands. So this fallacy that there is no money, to us, it does not exist, because if the same minister who can go out there and spend on advertisement of NHI, and say we are spending 28 million on advertisement of NHI, and I'll ask ourselves the question, why do you advertise NHI? Because you told the nation that South Africans love NHI, so why do you advertise to them? So this is what we're facing as healthcare workers. We're facing a pinch. Our healthcare system is in a dire state, in a crisis.
Dr. Mvuyisi, let's also talk about, those doctors you mentioned a bit earlier on, more than 1,000 of them who are qualified, who went through the rigorous 8 years of medical school and of training. How are they feeling if they are continuously being told that, you have studied for so long, you've dedicated so much of your hours, and there simply are no funds to employ you in the system?
Well, they feel betrayed by this government. They feel neglected. They also feel that they are not given a chance, to exercise their skills, to prove their skills with communities, to assist where, you have heard that in the rural areas, there's a dire shortage of doctors. And this government has been telling, untruth to the South Africans, saying that doctors don't want to go in the rural areas. It's a joke, it's a fallacy, it does not exist. Doctors want to go in the rural areas. It's just that this government has no money because they have lost all the money to corruption.
And when it comes to, healthcare being prioritized, what avenues can government explore? I know that you've touched on the issue when it comes to the advertisements for the NHI, but surely there are other means to ensure that, these doctors who are languishing at home can be employed through the system and can be used by government at healthcare facilities.
Yes, we just need a willing government, a government that is, sympathetic and empathetic to the communities. Communities are dying, they've got long queues. Some patients are turned away from hospitals. Why? Because in some hospitals, Mali, at night there are no doctors. The spaces there are empty. To fill in the spaces, because the existing doctors have done their hours more than they can afford. So those patients will be turned away, or they will find that there are no doctors in the hospitals. You can imagine the complications, and that patients are dying from that. So those are the serious implications of not having enough healthcare workers in the workplace.
All right, Dr. Mvuyisi, thank you so much for your time. Certainly there, painting a bleak picture when it comes to the healthcare sector in South Africa. That is Dr. Mvuyisi Mzukwa, the South African Medical Association chairperson, also there calling for a willing government to ensure that healthcare is prioritized in this country.